Hey everyone, and big welcome to our podcast, which is all around transitions and bringing people home from hospital, supporting people in their own homes. This is all about the journey home and all of the input that needs to happen for people who might have a learning disability or autistic people. Um, the goal of this podcast is to give everyone some insight and an overview of all the different pieces of the puzzle that need to come into play to support people to live their best lives. And today we have the wonderful Ophelia with us, who is one of our occupational therapists at Catalyst Care Group, to talk to us a little bit more about the world of occupational therapy.
Thank you for having me.
You are so welcome, Ophelia. It would be great to hear more about your journey and what led you to become an occupational therapist.
Yeah, sure. So for me, it's the same as quite a few other occupational therapists. I wasn't born knowing I was going to be an occupational therapist, to be honest. I have tried many different career paths and did a whole separate degree. And then when I was in my mid-20s, I had lots of different things that I was interested in. And I didn't know about this thing called occupational therapy until I met an occupational therapist. And so I spoke to an occupational therapist and she said, hey, how about you utilize your skills as, say, for instance, I love yoga and I love music and I love helping people and I love dancing. I love gardening. My friend said, hey, I think you should look into occupational therapy. I'd never heard of it. I don't come from a background of healthcare professionals in my family. So I Googled what is occupational therapy. I found opportunities to volunteer in different occupational therapy services to learn how vast it was. And then I found myself a postgraduate course at Cardiff University. So I did a 2-year accelerated course that meant I got my PG dip in occupational therapy, which is your degree and a little bit more towards your master's. And a lot of placements on the job, a lot of essay writing, and through many times failing and trialing and erroring, I got it in the end, and that was my journey into it. And a lot of people on my course were came from the same feeling that they weren't born knowing about occupational therapy. So I think it's not the same as, say, nursing. Lots of my friends in school thought, oh, I'll go into nursing or be a doctor or a physio. And the reason why, at the point, I think, when I thought, what could I retrain in, I looked into occupational therapy, and yeah, it seemed like such a vast vocation that would enable me a career that could be specific to my skill set as well as helping other people. That was my journey in.
No, amazing. And do you know that really resonates because in the same way, I didn't wake up one day thinking, I know I'm going to go and become a learning disability nurse. I kind of fell into it through becoming a support worker and seeing the difference that can be made for people. Um, but I'm going to be very honest and quite vulnerable with you. I've been working in learning disability and autism for 24 years, and I know the value that occupational therapy input brings. However, I would love a really tangible explainer on what it actually is, because I know that a lot of us hear about occupational therapy, about OT, but can you talk us through what it is in a nutshell?
Of course. What is occupational therapy? So it's looking at a person's occupations, and they are things that you need to do, want to do, and have to do in your life. And this can be broken down into your leisure, things that you do for your leisure. So whatever is meaningful to you is going to be completely different for me in all these categories: your leisure, your self-care, and your productivity. And we see how you, as a physical being, a being that has mental and cognitive abilities, you have spiritual needs and you have motivations. all of those things are you, and they are also going to change throughout your life. We change our occupations and our needs and our wants throughout our lives, and also the people, the social environment that we're in, and the physical environment we're in. So there's many factors that make what is meaningful occupation to you different to what is meaningful occupation to me. So what occupational therapy does, it's a scientific base as well, which is great because this is so vast. How on earth do we measure such a unique human experience? We do this through a lot of scientific evidence. So there's a huge evidence base to give us clinical reasoning to decide what step is next. And through a process of assessment to understand information gather, then set some goals from our assessments, which will be an intervention. And we'll say we could do an intervention which could be whatever it is that is the need. So let me say this again. So we've got going through the process of how this would work. We have your assessments, then your intervention, and then your evaluation. So using that process, an occupational therapist will be able to use your strengths. We don't necessarily need to focus on your limitations or your diagnosis. We use your strengths and we use your motivations to help you develop in the things or continue to do the things that you need, want, or have to do. It's quite a vast topic, isn't it?
I can see that.
Mm-hmm. Another factor which I didn't mention in there, your sensory needs as well. There's so many aspects about the human experience that make your occupations unique to you. So it's the job of occupational therapy to find out what that is and to help you achieve that at the level that is at the level of also finding out what level of support you might need to achieve that. So some of us might need more support, some of us might need less support, some of us might need support for a short amount of time. And so we look at what support levels we need, and both from social and the physical environment. It's very vast, but using the process of assessment, intervention, and evaluation, we can break that process down and manage it and measure it.
I think that's so critical, and I can tell how passionate you are about occupational therapy, and I can start to see some of the value that it brings particularly for people who might have been detained in inpatient mental health units for extended periods of time, and the ability as an OT to go in and look at someone's current circumstances and what their lives might look like when they move out into the community. I wanted to ask if there were any stories that you're able to share about where you might have gone in to assess somebody for occupational therapy input and what you might have been able to do for that person and with that person to achieve their meaningful occupation.
Yeah. Occupational therapy. As an occupational therapist, I've worked on a neuropsych rehab hospital. I've worked in learning disabilities in residential homes and in schools. I've worked, I've worked in a number of different settings that shows me how unique that experience is of support. For instance, helping someone who is sectioned, who has limited control over their lives, and that might be due to legislation, let alone restrictions due to, say, for instance, if they've had a brain injury. So their level of function might have changed really dramatically from 4 months ago. And for that person to understand that might take some time and to understand where they are at. So what we do in that setting, an example of supporting someone to engage in meaningful activity when they are restricted, and finding out what activities they were doing beforehand, finding out what interests them, what drives them to wake up in the morning, to get up, to feel tired at the end of the day, like they've achieved something that makes you feel like, oh, that's another day. I can see where I'm going forward while we're in that place. So we set short-term and long-term goals, and working within an MDT as well. An MDT is a multidisciplinary team. So me as an occupational therapist, I'm working alongside speech and language therapists. I'm working alongside doctors, nurses, an array of therapists, from music therapists to physiotherapists, psychoanalysis, or PBS, lots of different support to find out how we can help that person in a way that is reducing or understanding the risks to them, that person, and to the people around them, and both the social and physical environment. So we could find environments that maybe that person can go, and we could do, for instance, community assessments. This is one avenue that we could support someone with, to find out what level of support that person would need to be able to go to the shop. So just because they are sectioned and they are not able to go out whenever they want, we can still find ways that they can go out every day and go and buy some food, so that later we can cook that food. And then when they're leaving hospital, totally dissociated and disorientated from the things that they need, want, and have to do. And then finding out as well, doing things like a home access support. So when someone is leaving hospital, we would do some assessments around looking at their home environment. It might be that their home has been left for a long period of time. So we want to make sure that that home is in a state that is suitable for them. If there are risks around like substance abuse, making sure that that person feels supported, so that when they're returning home, it isn't overwhelming, making sure that there aren't loads of letters on the floor, so that that environment is a supported transition. And then finding things in their local community. So if some people might go from, say, a hospital setting, whether they've had a physical disability, a mental health intervention, whatever it has been, once they've finished their hospital, they've been discharged from hospital, maybe they go completely back to their usual life. They're looking after their kids, they're doing their job, amazing, that's brilliant. Some people, it might take a year, it might take a little bit more time to settle that in. So we can find vocational options in their local environment, so they're not returning to a home to think, well, what am I meant to do now? So we can find things in their local environment. We can find groups, clubs, volunteering. Again, we would pass that information on to the next occupational therapy. So depending on where you sit in a team, if you're a hospital occupational therapist, you would do your work, and then you would say, find where the next occupational therapist is in the community setting, and you say, hey, here you go, here's all our information, what do you think? And have that transition communication as well. I think there is a lot to say about that, in just communicating and sharing your resources. I'm finding that in Catalyst Care Group, where I'm working now, I work a lot with external occupational therapists and external MDTs to utilize the reports that they are writing and when they're discharging, and using that in our service, so that we're continuing that support and it's streamlined. Exactly.
Because otherwise you're going back and trying to reinvent the wheel again for a person, and that can be very disjointed.
Yeah, exactly. And I know from my experience, if I broke my leg, for instance, and I was in hospital, and it was, if you get asked the same questions over and over, it's a lot. So feeling when you're in that system, I imagine that you're being supported and you're not like on your own telling different people the same information. I think it's really helpful. Like the system is supporting you rather than you're having to fight your way through it. So I hope that helps people.
No, absolutely. I think people at the core, we all just want to feel heard. So having that communication and that cross-working between hospital teams and community teams is really, really important. No, thank you. I can see there's a lot of work that you do, and it sounds to me like there's a lot of skills building which goes hand in hand with positive behavior support, for the people that we support within Catalyst, and for people who might have acquired challenging reputations over time. That element of skills building and meaningful occupation is really, really important. So thank you.
You're welcome. A lot as well about what I'm doing is finding out why, same as like you're saying, working alongside the PBS team and working alongside our SALT team, finding out why behaviors are happening, or why something takes so long. So I will speak with the person who we are supporting. I'll speak with their family and their care teams. And if someone feels like something is something they want to work on, when we figured out the data of that's happening, we can do assessments to find out why, whether that's doing a sensory profile for someone, whether that's looking at, community access support, transition support. If someone is, say, for instance, struggling physically from sitting to standing up, just knowing that information, we can understand why someone might be distressed when every time we ask them to get a cup of tea for themselves, it takes a little longer. So it's when I mentioned earlier about having that assessment period, it's very useful to information gather, to understand what intervention is going to be most appropriate for that person.
Absolutely.
And then we evaluate it. Did it work? If it didn't, then let's go back and try some more things. Communicating as well, just keep communicating.
That's it. And the ability to step back and try and pick up on the details that other people might be missing based on your training and experience. Perfect, thank you. So moving on then, and you've kind of spoken a little bit about how it might benefit people. Are there any other ways that a good occupational therapy input can benefit people?
We aim to make occupational therapy goals achievable. So it feels really good for me if I am trying to do something and I can achieve it. If I try and do a task, for instance, tidy my very messy room, and it's too messy, it's overwhelming. So we can break down that task and look at it so that it's achievable for a person. And I think that is a benefit of occupational therapy, because we're constantly reviewing that intervention as we're doing it. Once we found out what it is that we could do to support that person, for them to do the things they want or need or have to do, we can break that down then to make it achievable, set small or large interventions that are measurable, not only in what we're doing. So that example of me tidying my room, we could say, okay, Ophelia, why don't you just you like the pink stuff in your room, so pick up that first for the next 20 minutes. So it's timely measurable, it's clear what the intervention is, and then if that's been achieved, then we can go back and say, okay, now why don't you try pick up all your socks, because now we know what socks are, and we figured that. So it's about breaking down the task so that it's achievable. If I'm physically struggling to bend down and do it, let's try different aids. So it's looking at a variety of support that might support someone's physical, mental, or spiritual or emotional well-being, and as well as their sensory well-being. It's that the rooms in my light are way too bright for me to even begin tidying my room. So let's put I actually love a lava lamp. So let's get me a lava lamp and make this and put on my favorite music, and maybe we'll put some nice lemongrass smell, and tidying my room now is more fun. So there's loads of different ways we can look around it to see why is that person struggling in that thing that they need to do? What motivates them to do it?
Perfect. Thank you. That was really, really clear, and people clearly do benefit from the interventions that you guys design and then implement. So my next question goes a little bit wider. Tell me where people might be able to access occupational therapy support in our health and social care system.
This is a vast question. So you can access occupational therapy support in schools, in hospitals, in social care. So we're in all settings, and we're growing as a profession. We are going further afield to charities. There are a number of different organizations and settings in which occupational therapists can be employed to support the people in the service. If I was a person and I was looking for an occupational therapist, I would type in maybe to Google occupational therapy. And if I knew, say, for instance, if it was a physical support that I needed or mental health support that I needed, type in that into Google, usually, and maybe your local authority, your catchment area, where you are, your location. Google can tell you a whole array of both NHS, private, and charities. Again, I'm going to chat with your GP because they can signpost you to a number of different services. Occupational therapy is definitely one of those services that they'll be able to support you with. So, asking around, having a look at charities, having a look on Google, and Catalyst Care Group, we've got some.
No, amazing. Thank you. Again, I think it's one of those professions that people aren't necessarily as aware about as we could be as a society. So no, that's really, really helpful. And I know that for clinical interventions, when people are not well, going to your GP should open that referral pathway to get the occupational therapy support that you need. And I've got one last question for you, Ophelia. What is your favourite thing about being an occupational therapist?
I love variation in my life. Occupational therapy definitely brings me that. What I love about this compared to, so I've been a support worker and there was a lot of variation as a support worker as well. I love that there is a career path here for me. I love that I can evidence base what I'm doing. And I'm also working in a wider team. I have a HCPC registration, which is a license body of support. So if you wanted to see if someone has a registration, you type their name into the HCPC website and they will have that. And that means that you are a practicing occupational therapist or a healthcare professional. And I also am supported by the Royal College of Occupational Therapy. So that's another thing. If you're an occupational therapist, I would definitely say subscribe to RCOT, Royal College of Occupational Therapy. Or if you're just interested to find out more about occupational therapy, go check out Royal College of Occupational Therapy online. A lot of resources there, to explain more about what the profession is and how it's growing.
And I think that's really, really important for people, especially parents who are looking at occupational therapy input for their children or families that want to get some OT input for their loved ones who might be struggling. So RCOT is a good place to go and find information. And I'm sure on some of the NHS websites, there'll be easy read stuff on occupational therapy. Are there any other places that people can get information on OT?
I would say, also there are podcasts and YouTube. When I was learning, like I was saying, I had no clue what occupational therapy was when I first started learning. So I was YouTubing everything. There's a lot of books out there. There's a guy called Keel Hoffner, who's like the godfather of occupational therapy. So if you like reading, there's a lot of that. For me, that was quite overwhelming to start with. So check out YouTube, type in what is occupational therapy. It's about finding out what's meaningful to a person and helping them to achieve their strengths, to utilize their strengths to make their lives their best lives. And that's an awesome thing about occupational therapy. It's completely unique. Everyone is different. Everyone we help has a completely unique experience, and our therapeutic relationship is completely unique. And at the same time, it's evidence-based, so it's a safe therapeutic practice. And I love that. It's exciting.
Amazing. Thank you so much for spending time with us this morning. And if you could share the link to the book that you mentioned, so we can put that into the comments on this podcast, that would be fab. Any last comments, Ophelia?
I look forward to continuing learning about occupational therapy. I think that's the other thing as well. Once you've qualified as an occupational therapist, that is really the start of your journey. So we are learning every day about how best to care for people and support people. It's a continued journey through healthcare, social care, legislation, and listening to each other. we're not all that different, and we're all completely unique at the same time. So it's a journey I am lifelong committed to now.
Well, thank you so much for joining us, and thank you for sharing all of the information that you have this morning. We can see that it is a massively varied role, but we can also see the huge benefit that it brings to many of the people that we support, certainly within Catalyst Care Group, but we know in the wider sector, you guys are making a huge impact. So thank you very much.
Welcome.